that this wasn't a party for the staff, but really for the clients. It's something that's been historically done, and we have approved those, and I feel like I was able to save them from the clutches of budget distress. We're also participating in World AIDS Day, December the 1st, as a department will be providing some staff to do outreach again to the communities that are affected by HIV and AIDS. A few other contemporary issues and problems I'll just talk about briefly. Some of you, well, most people are aware of the Saugus school shooting, and just to let you know, a sense of this department is that I come in every day and sometimes I'll listen to the news or I'll read the newspaper, one or the other, and I kind of know what my workday is going to look like. On November the 4th, it was just shocking to hear what had happened in that community. But I also knew that we were going to be deploying clinicians. So DMH, the Emergency Outreach and Triage Division under Deputy Brown, sent out 15 clinicians to that site to be available to provide services to the students, the parents, and others in the community. On the next day, we sent 6 clinicians to a church nearby in Santa Clarita to be available for those same folks and to the community at large. And LACO requested 8 clinicians, and we reported to the Saugus School District to the other schools to be available because of the impact of this type of trauma, which is unfortunately all too common. And we continue to provide support to that community and the schools affected by that incident. There have, as you know, been throughout this season, fortunately we had rain yesterday, but we had multiple fires. I wasn't here for the last town hall meeting, but I think somebody probably spoke with you about what the department was doing in response to those fires. So I won't go into details about that, but just know that we were present on site helping to man shelters, and emergency response teams were deployed. The next thing I'll talk about is another unfortunate event. If you watch the news, you do also see occasional times when there are officer-involved shootings that result in fatalities. And when I first came to the department, a conversation was being held about, is there something that the department can do regarding custody-involved deaths or so-called officer shootings? And there was some concern about that, because if you have someone who's been essentially killed, or in the family's idea, murdered by the county, then will the county be able to provide a response that is supportive? And will there be some conflict of interest? Because if you send help, will that be perceived as, well, you're admitting that you did something wrong? Well, our view is that if people need help, we need to be there to give them help. They can always say no, but we need to at least offer it. We were told that this was going to be a fairly small program and that there would not be that much of a need for us, but I did check with, again, Deputy Director Brown, and found that since August 1st, we have had 15 incidents where we've deployed because of these events, which of course gives me pause, and many of them have been monolingual Spanish speaking. So we've had to pull supervisors who are generally in the EOTD or PMRT or outreach teams to do this work. And we're now looking at how can we respond to these calls and dedicate some staff, because it is an unfunded initiative. It's something that the department is doing because we know it's the right thing to do, and it's also in response to a board motion and request. The last update on contemporary problems and programs is the Intensive Care Division, which is currently under the leadership of Dr. Amanda Ruiz. Right now, the short thumbnail summary is that we've had in the past something called Countywide Resource Management and something called the Treatment Authorization Unit, or the TAR unit. The way that I understand it, because I have to simplify these things for myself, some work with people and some work with paper. The Countywide Resource Management Group was deployed to go out to hospitals to evaluate folks to determine were they at the appropriate level of care, could they be transferred to, say, a step down, a longer term care facility, or someplace in the community, whereas the TAR unit looked at chart reviews to determine if a admission to hospital, and this is in our fee-for-service network for the most part, if it met what's called medical necessity. Did that person who got admitted maybe from the emergency room, did they truly need to be in the hospital for more than a couple of days to get stabilized? Because sometimes hospitals may keep people for longer than they need to be, so there has to be some oversight, which is something that our department does. Well, we're now looking at merging those two divisions together, because we feel like the best case scenario is when you're looking at the person and maybe doing an interview and also looking at the documentation. So Dr. Ruiz is trying to blend these two cultures that have been very different, I would say for decades, into one codified intensive care division, which we're working with our internal consultant, John Franklin, to make that happen. So more to come on that as we reframe that network. The two follow-up items I had, I think, in the couple minutes that I have left, one was from Commissioner Ogawa, who I don't think is with us, but he asked about our approach to customer service. I will just say that when I asked around, it turns out that we have had a long-standing quality improvement project. Last year, over 4,000 folks were interviewed both pre and post with the survey that looked at specific aspects of care in terms of not the clinical care, but how they're perceived when they go into a clinic environment, who answers the phone, who greets them, and who takes them or escorts them back to the room. Helpfulness, flexibility, dignity and respect, and welcoming, and also professionalism were the aspects that were looked at in this survey. The results overall were positive, but there were some comments that made us concerned. So we did do an intervention where we increased training. We made it available in person and online for our staff. There were a few topics that were included in this, including, how do you approach customers in a sensitive way? How do you increase your listening skills? And pre and post survey, there was some improvement. It's a fairly dense report. It's about 18 pages, and that's the summary. I have the 42-pager for somebody who might be interested. But perhaps the most important thing that I have in the way of feedback is that we can be better at using technology in the department to give or to receive customer feedback and to gather it. The last update that I have is really from Commissioner Turner, who asked about the post-release from state hospital program for those folks who perhaps have been involved in the justice system. And I had to refer him to our new director of forensic psychiatry, Kip Thompson, and their conversation, I think, was basically focused on the Conrep program, which I have learned that the state actually runs, and they pick providers in the community that the summary is they're falling short in many, many ways. And Harold, you have brought this to our attention. I'm talking with Kip because we both feel like even though it's not under our watch, we need to be as influential as we can to try to see what changes we can make. And we're investigating ways that we can offer support to see what the department can do about that. And that's my update.
Thank you. I wonder if it was helpful to have them organized in that way, because it was a way for us to control our own desires to ask you a million questions each. So we can see if you have recommendations on how to change up the buckets or do away with them.
I think they're fantastic.
Okay.
I'm an operational chief deputy, so
Yeah.
if you give me a directive, I can execute. So I guess I'd like to hear back from the other commissioners what they think.
Okay, and also we can go to questions. I know that Commissioner Daglish has one, and Cooper. Okay, let's go.
I'm thrilled to hear about the customer service aspect of it. And I wanted to mention that I believe that some reports have been related to the security officers, and if they're contracted out employees, then that training, I guess, would be different, or how would that group be trained?
It's an excellent question, and this has come up. I went to the USCC for the LGBT group, and they brought up just issues of sensitivity. When they come into a building, how are they questioned? How are they searched? This has come up in some of our directly operated clinics. It's important to know that the security forces are not DMH employees. There are two different types. Some of them are from the sheriff's department and they're county employees, so we might have more leverage with them. But we don't pick who comes to that location, but we can give feedback to their supervisors if there are problems, and that does happen. And I think in general, the bigger issues might be with the private security firms that we have contracts with, where I've talked with Damian Parker, who's the head of facilities, to address to make sure that they're getting not only sensitivity training, but implicit bias training, because we can build that into their contracts if it's not already there. In fact, some of our providers in the community do have that type of training available to us, and they've told us that they'll work with us to make sure that we address that.
Thank you. Commissioner Cooper?
I might add, you might want to have them do mental health first aid training as well.
Right. That's a big part of it. In fact, the customer service training that I didn't go into detail about, a part of it was helping people understand what the lived experience of someone might be who's coming in distress, because they're not going to be at their best. And that doesn't mean that you don't meet them where they are with respect and sensitivity.
So I actually have a comment, and I